Hello, in this video, I will be talking about trust and distrust in your doctors. Before I go on, I'd love to invite you to subscribe. We cover a lot of things related to working with your healthcare team, taking care of yourself, what to expect when you go to the doctor. And we're always putting out new content. If you want to know more about what might be offered to you as part of your treatment plan, go to yerba.com to get your personalized report. So trusting in our doctors is such an important part of our own healing and getting through treatments, no matter what you're being treated for. If you're somebody who's watching this on behalf of somebody going through breast cancer treatment, you know this too, that it's so important when we are not the experts, or even if we are an expert ourselves, to have trust in the people taking care of us. There are a lot of things that doctors can do to break trust. I'll go through a few of them, and I bet some of them resonate with you if you're watching this video. Number one, they may not be prepared for your office visit. They may not know everything that's happened so far. You may feel that they haven't spent time getting to know your situation before they meet you for the first time. That can hinder trust. Another thing they can do is not listen. If they plow over your words, if they interrupt you, if they hear something different from what you meant to say, that is one of the key things that breaks trust. They can let you down and not fulfill expectations that you had that maybe they even told you they would meet. So, for example, I will call you with this test result on Wednesday at 6 o'clock, and then they don't. And they don't call to explain why they haven't called with the result because it's not back yet. So they can fail to meet your expectations. It's possible you also are comparing them to people that they're just not like, and that this isn't necessarily their fault, but nonetheless, trust is affected, isn't it? Other things they can do is they can confuse your case with another person's case. I have to say, this has happened to every single physician. It is one of our most feared mistakes we make. If a chart is put outside the room and we walk in to the room and it's the wrong chart, and we call you by your wrong name, that just fractures trust. You're wondering what other mistakes are going to be made. Other things that can happen, of course, is doctors can make mistakes. We are only human. Things can happen. Technical errors can happen in an operating room, or somebody can click the wrong order for an anti-nausea medication. We do make errors. It happens. So these are just some of the things. My guess is I'm going to be reading your comments about other ways that doctors can break trust. Oh, another way is they may not give you all the side effect information you need. That's one of the comments that you have made. Or they might use language that's unfamiliar to you, use a lot of jargon, and you might wonder, what are they really saying? And like we covered when we talked about anger, check out our video on anger, you may also question their motives. You may even wonder, are they offering this treatment because they will be paid more, or because they're raising money for pharmaceutical companies? So there are lots of ways in which trust can be so fragile. And one thing we know about trust is that it takes a while to build, but it's so fragile. It can take only one thing for trust to dissolve and be demolished. So those are all the things that can go wrong with trust. A little bit about what trust is and how important it is to you. What can you do if trust is broken? This is a hard one, and it's going to be different for every single person. Here are some things that we think might be helpful for you to consider, an invitation to think about some things you can do. The first and most obvious is you can change doctors. Even if somebody recommended this, let's say your surgeon recommended this particular oncologist or radiation oncologist, it doesn't mean you can't switch. You know, most of us have a whole network of people we can recommend, and many of us understand that once trust is broken, it can be hard to regain that trust. So changing doctors, changing health systems is definitely an option if you live in an area where you have access to more than one doctor in that particular specialty. If you are thinking about changing, it's important that you ask around, because now you're particularly tender. What if switching is not an option, or you believe you're seeing the best doctor for technical reasons and you don't want to switch? You want to stay with that same health system, or let's say it's one person on the team that broke your trust and everybody else is okay. How do you handle that? The first thing that I would recommend is that you validate that trust has been broken. Actually use that word for yourself and with a trusted friend. You can also talk with somebody in the practice about trust. And although this takes a lot of courage, talking with the person who broke your trust can actually be the most liberating and helpful thing to ensure that trust can be rebuilt. So as difficult as it is to talk about violations of trust, this may be a growth area for you that is in your best interest. The way in which to do it is to talk about it when you are feeling as strong and well rested as you can, to have somebody with you, and to let that other person with you maybe practice with you what you're going to say. Start with something general. Trust is really important. I feel very vulnerable as I go through treatment. And when this happened, I lost trust. You just want to use an observation. You don't want to use judgment words like you betrayed me, or you were sloppy, or you did something. You want to say how you observed things. You interrupted me when I was talking. I didn't feel heard. Because when you put people on the defensive, it's actually going to increase the schism between you. So you want to do this with good intentions for your own care, and to perhaps feel closer to the person you're trusting with your care, to make the observation and then describe how you felt. So you say things like, I was sad, I was scared, I am scared, I am worried, I am anxious. And then ask for their take on things. Because you've made an observation without judgment, you're very likely to see the true them. You're very likely to be told that they are sorry for the mistake that they made. I'm sorry I interrupted you. I'm sorry I didn't listen to you when you told me you were having this side effect. I'm sorry you're having such a tough time with treatment. When people are on the defensive, they're much less likely to do that. They're more likely to put up a shield. Now, it's not your job to take care of your doctor, believe me. It's your job to take care of you. And having trust is a key step. And also acknowledge to yourself that it may take a while for trust to be reestablished. You may always be a little bit on edge. You may find yourself double checking things, and that's okay. It's a natural thing. The other thing you can do is talk with somebody else in the practice, like a social worker or a nurse, and you can tell them about the concerns and make sure that they understand whether or not they have permission to talk to the person who broke trust. So if you're venting or talking or expressing yourself to a nurse and you don't want them talking to the doctor, you need to let them know that. Because we all work as part of a team, and the nurse is going to want the doctor to know that there's some trust that needs to be restored. If you just need to vent and you just need to check, am I going to be okay with this doctor, then that's not going to go to the doctor. If you really are upset and you don't think it can be fixed without some intervention from the part of the doctor, you can say, please don't tell the doctor this, but something needs to be done. So what can be done? Let's say you need to escalate it. There is somebody at nearly every health system called an ombudsperson. And an ombudsperson is somebody who can direct you to resources, whether it's patient relations or whether it's somebody just to listen to you, somebody who can help you understand, did what happen? Was that really an error? There's always patient relations you can go to. What I don't recommend doing is doing an anonymous review of somebody who violated trust out of anger or a feeling of getting back at the doctor. Because first of all, most patients don't actually believe those negative critiques, and the doctor, when they see those negative critiques, they don't know what they've done. They don't know how to get better. So you're not helping them take better care of future patients. And those anonymous things can actually lead to physicians becoming less caring. They become hardened. Not all of them, not all the time, but maybe you can see how that could happen, where they feel so defensive and so hurt that it becomes about them and not about you. I'm hoping this is helpful. I'd love to know what you have done. If you've had problems trusting your doctor or other members of your medical team, drop a comment or a question below. Again, you can go to Yerba.com to get your personalized report, and don't forget to subscribe to our channel. Thank you for watching.